We've seen Joe Namath on TV talking about Medicare Advantage, Medicare supplements and all that, and what's the difference, and you may have wanted to pick up the phone and give him a call. Don't do that. Don't do that. You got to call this guy, Gary Smith, Gary Smith Agency. How are you?
Good to see you. Thank you for coming in.
Well, thank you for being here. We're going to talk about the difference between the two.
Yes.
But I guess was it Smoking Joe or whatever they used to call it?
Pantyhose Joe?
Yeah, pantyhose. Remember that too. Used to put those pantyhose on. Yeah, what is the difference between the Medicare supplement and Medicare Advantage?
Yeah, and it is, in today's world, it's the topic that everyone's talking about because, again, you do have a lot of national commercials like the Joe Namath commercial that's really making the Medicare Advantage probably a little more popular, which is not a bad thing because for years the Medicare Advantage plans have been mischaracterized. Most agents don't even know how to explain it because they don't even understand what a Medicare Advantage plan is and what it was designed to mimic or replace. Mm-hmm. So when you turn 65, because you know you're around the corner, you have two options, a Medicare supplement or a Medicare Advantage. Now going back into the 80s, the only option you had was your original red, white, blue Medicare and a supplement. You didn't even have drug coverage. But in the 90s, because everybody was complaining about drug coverage, you know, if you look back and think about that, why would you work for 30 years with doctor, hospital, and drug coverage, and the minute you turn 65, the government thinks it was a great idea to not give you drug coverage? So again, it's because we really don't want government health care. Okay? But so finally in the 90s, seniors got drug coverage. Well, one of the things that they heard when they were out speaking to seniors about, you know, how much do you want to pay, what kind of coverage do you want, they heard over and over, we like our work insurance, our insurance at Ingalls, our insurance at Singing River, Gulfport Memorial. But we turn 65 and you take it away from us. You don't even give me a work style option. Mm-hmm. So the Medicare Advantage was designed to mimic work insurance. It's, you know, doctor, hospital, and drug all rolled into one plan. Mm-hmm. You go to the doctor's office and pay a copay. You have typically sometimes an 80-20 split, you know, it's like it's your work. Right. And then that, like your work plan, because you're on it, you have a max out of pocket. The most it's going to cost you in a given year. That could be a $3,000, could be $5,000, may even be as low as $1,500. But that's what Medicare Advantage is. And when you go to the doctor's office, what do? You show them your insurance card, just like you do when you was working. Right. And where you're dealing on the supplement, what I call the original, you should go to the doctor's office and you show your red, white, and blue card and your insurance card, because why? It's a supplement to Medicare. But Medicare only covers doctor and hospital. And that's where everybody gets confused. So they have to go out and buy a separate or standalone drug plan. So really when you're looking at, you know, the process for you, you've got the supplement side or you have the advantage side. It's a truck and a car. That's what I like to explain to everybody. Both the transportation, right? But they're two totally different products. One's a truck, one's a car. And that's why you need to look at it like on the advantage plans and the supplement. They're both Medicare based, but they're two separate products because they're designed to do two separate things. One's designed to mimic your work insurance you've had for 30 years, and then one's designed to be the traditional supplement to Medicare. And then, of course, as you know, like you mentioned Joe Namath, he comes on TV along with other national, I guess we could say, characters that have been paid to get out here and talk about it. All these benefits that you deserve, doctors, give backs, gym membership, grocery card, et cetera, well, half of those benefits don't even exist on the Mississippi Gulf Coast. And then we hear all these horror stories that people are calling these national phone banks, signing up, because why? All the benefits that you deserve. Then they find out the doctor's not even in the network, or the hospital they use is not even in the network, because why? That wasn't the conversation. It was, you call the number, let's get you signed up. And they sign them up. And now you're stuck in a plan you can't use. And who can you call? Well, you got to call 1-800 wherever. Yeah. You're certainly not going to be able to drive down to that person's office and ask them what's going on.
No, that person that sold it to you is probably in New York or something.
Exactly. So, or India, or I mean, may not even be in this country. So, to me, that's a problem. Being local and being a local business who has it all, I go back to what we've talked about in the past. Why would you not be buying the plan from a local business? Well, if you're not buying it from me, I would buy it from another one, but at least buy local, where you can at least get honest, ethical, and true advice about your insurance.
That's a good thing about your company. I mean, you're local here in Pascagoula. You are a brick and mortar building, and to where people can come to you, or you go to them,
Right.
and be happy to to talk to them about.
And in today's world, we can do everything over the phone because of COVID. And a lot of people are scared to get out,
Yeah.
but we're open. I mean, so masks are optional now, but if the COVID thing kicks back in, or flu season gets back, and we have to, masks are now required again, we're still going to be open. We're going
Right.
to follow the rules to keep our employees safe, keep our clients safe, and
And the other thing too, as you mentioned, Gary, you try to call back that 800 number they called you from. It's going to probably route you through Timbuktu.
you're never going to speak to that person that sold you.
No, never.
And we're
Because they're probably sitting there with a script and everything to fill it all out and to sell it to you. And I don't know, they don't know.
Well, you
They're-
said
they're
they got a script,
butt
but
from a hole in the
you're
ground.
never going to talk to that same person.
No.
We're here, you can always speak to me. You can always speak to my staff. You can always speak to the person that enrolled you. And then, of course, as someone who buys a policy, you also get a dedicated customer service representative. So if I'm not available, if the agent's not available, we have a CSR that's available. So someone here is going to be able to help you. You're not going to have to wait 4 days for a phone call, return call back. You're going to be speaking to someone generally within 5 minutes about your issue or your problem. And we normally can resolve most of them on the phone the first time. It's just a big difference.
Yeah, it really is. And then you can find out about the differences between the Medicare Advantage, Medicare supplements. I mean, which would, I mean, but my situation, I'm still going to wait a few years before I
Right.
retire. Would I do best with that?
It really comes down to tell people lifestyle. If you're traveling all over the country, if you're
I
fortunate
plan
to
on
be,
traveling.
you need a supplement because as you know, your work insurance is network based. But if you're just got a condo in Gulf Shores, you're staying local, or you're just kind of doing a little bit of travel, either option is a great option.
Okay.
And it comes down to, again, what can you afford?
And a lot of people don't know what they want to get, and that's why they come sit down face to face with you.
We need to sit down
or
and
any of
talk
them,
to them.
and talk to them, and this is how I live. This is what I do. This is what I can afford and everything.
It's a overall approach.
All right. Always a pleasure, Gary.
Yes, sir. Thank you.
all for wonderful information. Again, if you have any questions about Medicare, what would be the perfect plan for you or anything like that, give Gary a call. They are here. It's a real building over in Pascagoula across from the Senior Center. Come and check them out here at the Gary Smith Agency.